Can you drill down specifically to why value-based care matters for population health?
That's, I think, a core question of U.S. healthcare. So, we live in a predominantly, UW Medicine is no different than many, many other healthcare delivery organizations across the state, across the country. The United States has chosen a model that is really based on different kinds of insurance, oftentimes employer-based. There are governmental insurance programs. In fact, the largest ones like Medicare and Medicaid are government, but we're mainly driven from a financial perspective by employer-based or commercial insurance. And we've paid historically on a fee-for-service basis, which is very transactional and very much where a patient comes in for a service, and then we deliver that service, we get paid for that service, the patient moves on, and there's no necessarily attached outcome-based parts of that. There's not necessarily even a service or quality-based part of it. When it was first instituted here, now 100 years ago, as we evolve from more of a community-based healthcare to a more formalized insurance transactional healthcare system, we started to realize that it was driving costs and procedures, but not necessarily delivering health outcomes to our community. I know this audience more than most know that the United States lifespan, which we could argue life expectancy, is a pretty solid measure of how we're doing as a community. The United States in the 1980s was within the pack of the OECD, the other economically developed countries. We were within the pack of that, below median, but still within the pack. And then every decade since there, we've fallen to now by far the worst country within the economically developed comparator countries. And value-based care has become more and more important over time because it's a way of looking at evolving our payment models. It's not the be-all, end-all. I think value-based care can also mean different things to different folks. But the way we define it as payment for anything in addition to just that transaction. So it could be quality-based payments, it could be experience-based, it could be cost-based for populations of patients. And how do we better align incentives in that so that we can both address health outcomes better as a population and as a country, and then realign health systems which are perfectly designed to optimize fee-for-service healthcare over the years, and then many organizations like UW Medicine that are very mission-based, trying to figure out how we can develop payment models that help to fund the kind of programs around food security and those things that aren't just sick care, but the drivers of health outcomes for population.